All right, welcome everybody to our Facebook Live on coronavirus. We knew it was going to come into the United States at probably some point. It just happened to be Washington State, the first place to see it. I know you probably have a lot of questions and maybe some concerns about what it is, how to protect yourself against it. We have Dr. Farshid Rafatnia, the chief hospitalist at Sound Physicians, in today to answer all of your questions, kind of give us some background about what it is, whether we should be concerned, kind of put it in perspective a little bit. Thank you for taking the time. I know you have been a busy person today. We kind of threw you into the mix and you're hitting all our shows and kind of laying this out for us, so thank you.
Thank you for having me. So first of all, the coronavirus, what we're talking about here is a new strand of that virus. But this particular family of viruses causes illnesses that we see every day. Frequently causes the common cold. Why we're being very concerned now is that it's a new strain of it that nature has never seen before, and as we all know, diseases that we've been exposed to that we can develop some resistance to. This is brand new, and we don't really know how it's going to affect us. So that's why we're being so cognizant about it and trying to be keeping our ear to the ground and cover all our bases.
I wanted to back up a little bit if we could and give people, I know we started talking about this locally, I think last week when some of the, maybe it was early last week when we started hearing about the outbreak in China, and then they started talking about the airports, and I can't remember if the airports, the screening was just yesterday or that was last week either. I've kind of lost track of it, but I know we did start talking about this last week. Can you kind of set up, and I don't know how much of the background you know about what's been going on in China. I think there are 3 deaths and like 200 cases. So in a place like China, ground zero as they've been calling it, we have 200 plus people that have gotten sick with it. What are those people experiencing, or do we know?
So it usually starts like a common cold, but it develops and you have more fevers, more cough that produces phlegm and pneumonia. So mainly the cases, to my knowledge, that have been hospitalized in China have been patients that develop pneumonia, either from the virus itself or that it weakens the body so much that bacterial pneumonia moves in. The patients that have gotten sick in China, once again, to my understanding, have been exposed to poultry that originated from a poultry and fish market. I don't have the exact details, but generally, as we're seeing in this disease, the people getting very sick are the frail patients who already have other diseases who may not be 100% healthy.
Well, I was going to say anybody with, and we find that typical around this time of the year when you're talking about our seasonal flu. It's just the people with the elderly or the very young or anybody with really a weakened immune system doesn't have those antibodies to fight back.
Correct. And but I still want to make sure that we understand most of the people that get infected with this virus are just going to have a common cold, maybe some fevers and chills, and not necessarily progress to being so sick that you need to be hospitalized.
Right.
And what I've heard about our patient here in the state is that he's doing very well, but due to an abundance of caution is the reason why the patient was hospitalized.
Yeah, this is from Providence Regional Medical Center, and I know this is that patient in Everett, and as I understand it, started feeling some of the symptoms, was updated on the news, and took it upon himself to check himself in and say, hey, I came from China and I could have this, but that does us all a favor, is being self-aware. So Providence Regional Medical Center is working closely with CDC, the Washington State Department of Health, and the Snohomish Health District to care for a patient who tested positive for coronavirus. The patient is in satisfactory condition. The risk of human-to-human transmission appears to be limited, but out of caution, the patient is being monitored in a special isolation unit. And within that, obviously now they're going back to anybody he had contact with, just out of that abundance of caution.
Correct. And we're learning more because it's a brand new strain of the virus. We continue to learn. I believe initial reports in the media were that it was not contagious between humans. Now we've learned that it is. So we're still learning more as we're progressing in the evolution of this disease. But this particular patient if the news of this, so we have to put it in perspective. If the news of this hadn't broken out, he might have just stayed, he or she might have stayed at home and had, quote unquote, cold symptoms for a couple of days, and we would have never known.
Right.
But due to that, it is a new virus. We don't really know what's going on. I think it's appropriate to be cautious, to work these people up, to see which people he'd been in contact with, and keep them under close surveillance.
So you made me think of something there, and I'll get to a question here from Brooke in just a second, but it sounds like this is obviously the first diagnosed case. That does not mean that there aren't some other people around the country who possibly have it, who are sitting at home sick right now and just don't know they have it.
Correct.
Okay, that makes more sense. Let's talk about the airports, because that was the latest news, and I don't know whether they didn't get out ahead of this enough, or what the protocols for that is. But we had the three main entry points, where you've got LAX and SFO in San Francisco, and then of course JFK, where most of these people would be coming into the country. But Brooke asks, and this is a question we had last night, why didn't the CDC test at SeaTac? Why did they do we know why they would just test for it at just those airports?
I don't know the thought process behind that. I'm sure there was some form of statistical analysis, because it is somewhat cumbersome, I'm sure, to do these screenings. So it may have been a resource question. I don't know.
Maybe the odds of them finding somebody who came through one of the other ports would be greater there.
So I try and look at things from a doctor perspective. So whatever we do something, we always assess the risks and the benefits of what we're doing, essentially the benefit and the cost. And we have to see that the benefits outweigh the costs for us to, even simple medications as ibuprofen have risks.
Right. Sure.
So I don't know what the thought process was.
And it's not really a fair question to you, because you're not part of the CDC, but I appreciate you taking it and trying to answer it like with your medical brain, how something like that, how you would work through an issue like that. We talked a little bit about folks in China, and I had heard that where they thought it was maybe animal to human transfer. How does it transfer, and do we know whether, I thought there was some question as to whether it transferred human to human, or how much do we know that?
So we know that it can transmit from human to human. How risky that is, or how much each individual person transmits the disease to other humans, is still being investigated. The theory is that there are a few patients out there who may transmit more of the disease than others, so-called super spreaders. For some reason, they produce many more virus particles that just spread, but we still don't
know why. Don't know whether it's because they've had it longer, or the stage it's in, or
their immune system. It could be different.
Okay.
And how it spreads from these types of viruses, how they cross from animals to humans, that's not really my area of expertise.
But we know it does.
But we know it does. Viruses mutate, and close proximity to animals, be it poultry, beef, pork, what have you, that does increase the risk of diseases transferring from animals to humans, subsequently mutating, and then spreading from human to human.
And let me ask specifically, Francisco asks, is it airborne transmitted? Or
we believe it is at this time.
What other way would it be? If it's coming from animals, that I don't know if those are live animals or dead animals. I mean, how else would it be transmitted?
Right. So the virus mutates as well. So it can spread from contact. So, for example, if you're touching animals and then end up touching your mouth or your eyes. Okay. But also, as you're coughing out particles that another person can inhale.
Okay.
So those would be the most common ways for it to spread.
Paula on YouTube asks, do you treat coronavirus similar to pneumonia?
So the virus itself, we don't treat. It's just what we call supportive therapy. So making sure you're hydrated, keeping your temperature down, things of that nature. When we're talking about pneumonia, there's viral pneumonia, which is caused directly by the virus. But the risky part is if somebody gets this infection, it weakens their immune system for bacteria to move in and cause a pneumonia. On top of that we have to treat with antibiotics.
Gotcha, because you got to wipe out the bacteria and hopefully get to that, and then keep the body hopefully regenerating.
We don't really have a drug that
Right.
hits the
You have
virus
pneumonia.
yet.
Here's the cure for it.
Yeah, that's right.
Peggy, how long could coronavirus be in your system before symptoms show? And I think you were saying it's similar to.
All right, so it can be up to 2 weeks.
Okay. That long.
So what recommendations have been, the last time I checked in with the CDC is when, if you're coming from that region of China and you come back to the United States and you've gotten sick within 2 weeks, to alert your doctor and let them know about your travel history. So I would say around that 2-week mark, if you were in that region 2 months ago, it's unlikely that this virus would be the cause of your illness.
I know we were talking off camera a little bit about putting this in perspective, and I wanted to do that for people just so we have an idea of, should we be panicking? I know we're making a big deal of it right now. You're seeing it all over the national news. You're seeing it everywhere online. Of course, we are all talking about it, and I think instead of causing people panic, if we can reduce that panic, I would rather do that if it's true that we can. And so why don't you put in perspective, because from what I've read, your risk of getting this is pretty low, and that's what the hospitals are saying, and you would have to really pretty much be in contact with somebody who came back from there and had it.
I would use a stronger word than low.
Okay.
I would say extremely low.
Extremely low.
It's funny that you should ask. My mother actually asked me about this because she called me and was like, "Hey, I'm seeing this on the news. What's going on?" And I tried to put it in perspective.
What advice do you give Mom?
Well, it's funny because my mother usually gives me advice too, and she doesn't always listen to me. But what I told her, and I'll tell everybody else the same, that you have to put things in proportion. Just by driving to the grocery store, which you don't consider to be a particularly dangerous activity, you're probably at 1,000 times higher risk of something bad happening to you during just that short drive than anything from this coronavirus.
Okay.
So there's an element of
It's possible.
It's possible.
Highly unlikely.
Highly unlikely. So I don't think there's any cause for concern at this time. Common sense precautions. Hand washing, like doctors always say.
Sure.
Purell if you're unable to wash your hands at that time. If you're coughing, for the sake of others, cough into your sleeve instead of your hand. And just purely common sense stuff. And that's the advice I give my family when they call me. And I'd say that same thing if I met a patient that asked me about it.
I'm going to ask Jen, who's running this for us back there. I know his chair is awfully squeaky. Is that coming through pretty harsh?
I can hear it, but
It'd be a little awkward if we got up and changed the chair right now during the Facebook Live, but it is. Okay, I can hear it. I just don't know whether anybody else, and maybe that's like.
I'll try and sit still.
It's hard to. Well, you talk with your hands like I do. I just like yours started, so I've got my foot planted down here to make sure mine doesn't squeak on top of it. We have a lot more questions coming in, but before I get to them, I wanted to ask about. Well, we talked about putting this in perspective, but also for people. How do I word this the best way? And we're talking about your mother's advice, and the squeaky chair got me sidetracked. Let me ask a question, then I'll go back to it because I know I'll remember it. Let's see here. Tracy asks, is it as contagious as the common cold? I think you already asked that or answered that.
I would say it's less contagious right now, this particular strain, from what we know. But that may change as we learn more about the virus.
That's okay, and that triggered what I was going to ask you, is when we talk about this particular virus, and you say it's extremely low risk to catch, then why do we have all these news agencies, everybody coming out, warning you about it, letting you know that this is here? And you had an answer for that, because I was curious about that.
So whenever we have a new disease, so that's when all the doctors and the scientists, all the people in the white coats get worried, because we think back on previous pandemics when, for example, the Spanish flu that killed millions. That was an influenza virus that had mutated a little bit. So we're always concerned, and we don't want another dangerous pandemic. So that's why we're trying to buckle down from the start, figure out what this is, how it works, how dangerous it really is. And people in the media piggyback on that, and it becomes a big story.
Sure.
But I mean, as a physician, as I tell my patients, we do want to have an abundance of caution. And if, God forbid, it would be a very contagious virus that would cause a high mortality rate, so people dying from
Sure.
it,
Well,
then we would have wished that going back in time that we would have been more stringent, trying to follow up, making sure that we're protecting the public. So that's why we're so judicious and so trying to be on top of it, because we don't want another Spanish flu
right.
incident.
Well, part of it is you don't know what you don't know yet, and until you fully understand it,
Correct.
It's easier to tell people, hey, just know this is out there. Take the
right.
simple precautions that you take to keep away from the flu or the cold. Wash your hands, Purell, things like that, just to reduce your exposure. Doesn't mean you have to lock yourself in your house.
Correct. Absolutely, 100% true.
So we have quite a few people watching right now, and I'm getting word that there is I don't know if panic's the right word, but there's a lot of concern out there. And if you're just joining us, we are trying to explain what it is, and the good doctor here has been able to do that fairly well. And the nuts and bolts of this are your risk of exposure are very low, that it's basically transmitted kind of like the cold or the flu, where it could be airborne or through touch.
Correct.
And you don't need to lock yourself in your house or lock yourself away. Do masks in public make a big difference?
So that's different.
You saw them all in the news in China.
Right. And I mean, I've been to that region for tourist reasons, and a lot of people wear these masks. It can protect you, sure. Not to the extent that you would probably hope for, that if you're wearing it, you're safe. What I typically see when people wear these masks is that they are not putting them on properly.
That's comforting.
So, but you will see, for example, you go to the hospital, and if you have the flu, when your doctor walks into your room, they're putting on one of these masks. And that will protect you to some degree, but that mask has to be changed very frequently. So it's not that you can put it on in the morning and then take it off when you get home.
It's a limit.
There's a limit to it. I don't think that the benefit of doing that, if you're sitting next to somebody that's coughing up a storm and is sweating, maybe it's not a bad idea to put it on, or maybe even switch seats. But that would go even if we didn't have this new coronavirus. I sometimes wear them myself or I have to when I see a patient that has the flu or things of that nature, to protect myself. For this particular virus, we're recommending a different type of mask that's not readily available. It's more of an advanced version, but it has a filter in it as well when healthcare personnel are interacting with the patient.
Right, close interaction and...
Correct, because we still don't know exactly how it transmits and what the risk is. So it's a step up from the mask, and it's not really readily available to the public.
We talked a little bit earlier about the pneumonia and cures for certain things. Somebody was asking, if I can find it, I think it's Natalie, is there anything like Tamiflu to protect against coronavirus? I mean, and I don't know whether Tamiflu or something that would...
Short answer, no.
No. What would you recommend?
Nothing that there's evidence for. I would
Nothing
say.
that you can go to the store and get something that's going to help.
Or a
help
ready
you.
prescription from your physician. No.
And certainly, it hasn't been asked yet, but I'm sure somebody will ask whether the flu shot will protect against this, and two totally different things.
Two very different things. You should still get the flu shot, because that will protect you from the flu, which I would say is at this time, a much more dangerous disease than this coronavirus infection. So I still recommend everybody to get their flu shot unless they have allergies or there's a reason why they can't take the flu vaccine. But it will not protect you against this virus.
How much more likely are you to get the flu here than this?
I mean, the likelihood of you getting the flu is so astronomically many times higher right now that I can't even put a number on it.
Okay, just try to put it in perspective for the people who are watching who still maybe have just joined and are...
I would say something like the difference is the flu getting here and this virus
Here versus
is
there.
some tiny...
Okay, here Peggy asked another question. Why did some people die from it? So those are the 3 people, I think, out of the 200. And I don't know what the number is today because I didn't have a chance to look at it. But it was, as of yesterday, I think it was more than 200 who had died and 200 who were sick and 3 who had died. I don't know that we know the circumstances of those deaths yet.
Yeah, so I mean, I haven't seen, if they've done any autopsies or any death certificates to explain exactly what happened, what the history is for these patients. I would assume that they were elderly patients or patients who had other illnesses as well. Usually when people die or from these things is from complications of the disease. So they have a bacterial pneumonia on top, or that the virus damage is so great that
They compound.
Exactly. But we can't say for sure, as I don't have those reports available to me. I'm sure in the coming days we'll learn more.
And Peggy, I see that was a long question. She has lots of questions. And this, I think you just answered this. Did they all have pneumonia or pre-existing conditions? And does that make a difference? The first one I don't think we can answer yet because we don't know what they had. But would that make a difference? And I think you just kind of answered that one. Did this strain come from animals? That's a question off YouTube.
So I don't have enough data.
But that's what not just the CDC, but that's what I don't know if that's the WHO is digging into that.
So that's the suspicion, but scientifically can't say either way at this time. We will know more, and I know that's a frustrating answer to get.
Well,
but
sure.
Everybody's working on it. The top scientists in the world are working on it. They have people on site. They're digging into it. So we will know more going forward, but at this time I can't really say.
So if you were for people who just joined, because I know we have several hundred people on right now, and I'm going to have to take a break because we have to do a hit for television in about 10 minutes, and I need to gear up for that, just so we're all ready for that. So we just got this update. Okay, 6 people have died, 291 sick in China, plus the one in Everett. So now we have 6. I don't know if you're aware of those, but now we're up to almost 300 sick. Those are the latest numbers. Does that surprise you that we're getting new numbers out like that, updated like that, with what this type of virus is?
No, I'm not surprised, and I think we're going to have an exponential growth, so it's going to increase rapidly.
Which typically happens in something like this.
Typically happens, and let's also not forget that we're aware now, so we're testing more,
Right.
and what we test for, we find, like we're going looking for it.
But that's a good perspective for people watching who are going to watch that number, maybe jump into the thousands, if not
Tens of thousands.
tens of thousands over the next couple of weeks. Because if you start it and then it spreads out, and then all those people before it's really noticed, that's how you increase it that quickly.
And let's also not forget that it is a traveling holiday in China, so people that were infected may travel, and that contributes to the spread. So I'm not surprised at all, and I wouldn't be surprised if we see much higher numbers in the coming days. But that's not alarming to me.
Do you think, and I don't know whether you can answer this, but do you think, given what you just talked about, how quickly something this might spread, the CDC, it would be prudent if that starts turning up at other places? Would you expect to see that at a lot more airports, or how does that typically work?
Right, and I
don't know if you can answer that.
Well, I would say, to the extent of my knowledge, we will see it in more airports. I think we have cases in Japan, in Thailand, but with the globalized modern world that we live in, and the airports and people travel all over the world, I am not surprised if we're going to start seeing this in more and more airports, particularly now since we're looking for it.
Right.
So in today's world, I think it's rare to have a disease that's contained to a single place, particularly if it's airborne.
All right. If you had to update, give one more. Okay, a lot more people just joined asking about symptoms. If you had to kind of the nuts and bolts of what we talked about over the last 20 minutes or so, what would you tell people who just joined, who want to know about the symptoms, whether they should worry about it, what we're probably going to see, and how would you calm any fears?
So the symptoms, as we've talked about, are usually the same as the common cold. We're talking cough, just not feeling well, maybe some muscle aches.
But that doesn't mean that unless you've exposed yourself somewhere, you probably don't need to be tested for that.
Correct. Now, what I think is when you need to go to the emergency room and that goes even if this coronavirus wasn't going on, is if you're starting having shortness of breath, if you're having chest pain, you feel like you're gonna faint, or you feel that, my God, there's something wrong. I'm really
intuition, right?
Intuition. Just if you're really worried and something just doesn't feel right, that's the time to call 911. If you have common cold symptoms, more likely than not, it's just a common cold. And if you're still worried, call your regular doctor and try and see them as soon as possible. We also have urgent care. But I just want to repeat: shortness of breath, chest pain, coughing up a lot of phlegm combined with these things. You feel like you're going to faint. that's when you call 911.
And back to for those people who just joined, those who are, we don't know why the people died, who did die, the 6 people, the almost 300 others who have gotten sick that have been confirmed sick. That's just what we've confirmed so far. But generally that is like the flu, where the weakest are the ones who succumb to this, those with no immune system to fight this off.
Correct. Generally,
Right.
That's
Not
the
always,
case.
but
not
generally.
always, but yeah, absolutely. And I would not be surprised if we find out in the coming days that the majority of the patients that perished were not healthy individuals to begin with.
Right.
But time will tell.
And again, for people just here, the risk of getting this, you said extremely low.
Extremely low. Absolutely.
Okay. I know there's, anything you want to add?
No, I mean, I'm telling my family, my mother, my wife, everybody, same thing as we always do. Vigorous hand hygiene.
This
and
time of
common
year in
sense.
general,
In general, and that's all you really need.
wash your hands, stay away from sick people, don't have to lock
Common
yourself.
sense. Yeah,
Common
Don't
sense.
lock yourself in the room. Absolutely.
Okay, Dr. Farshid Rafatnia, I want to make sure I had it right, Chief Hospitalist at Sound Physicians, and we're going to have you on King 5, 5:30 show coming up here in about 10 minutes or so. So if you'd like to join us. And any other questions, continue to send those in, and we'll try to get them answered for you.
Thank you very much.
Thank you.